Hello, my friends and family and esteemed colleagues. I'm going to address again spinal problems because I have been asked to do so. Many people, my brother was one of them, urologist, professor in New York Medical School. Well, sooner or later, almost every one of us will have developed a problem with a pain in the back. Now, we call it, well, it's age-related. Yeah, it's age-related because body can take a lot of abuse, and it takes very high level of toxicity and dehydration to start manifesting symptoms we call diseases. And you can notice elderly, especially people that used to work hard physically, like in villagers, they start to bend down. They cannot straighten up the back anymore. Start walking with cane, bent over. We call it scoliosis. The shape of a spine has changed. Now, why is that? When I was explaining about the joints and dehydration on a cellular level, what is keeping joint together? It's muscles. They are anchored to the bones through tendons, and then they keep the bones together. Now, contact point, where the bones touch, if they have to move, articulate, then they have a layer of cartilage, because bone on its own, it's not smooth. Periost is a rough texture. And if you would have rough surface of movement, you will have grinding. To prevent this, there is a layer of cartilage, which is extremely smooth. It's softer than a bone, made of cells adapted to this area, which are supposed to be well hydrated, and every time there is a pressure exerted, drop of water is released. So joints are lubricated by plasma, not water, plasma. Well, we always have to think of plasma when we talk about the body, because body cannot hold water. Water is not electroconductive. So it has to be in a plasma state, which means mineralized, so it has ions that will transfer electric charge. So when we are well hydrated on a cellular level, our cells are pressurized. They are hard, roundish. Tissue that they create is harder, and because it is well hydrated, cell can regulate its acidity, so optimizes it for the best possible electroconductivity. So what happens that well hydrated cells can hold electric charge. So no matter how much you work, and no matter how much you think, no matter in what situation you are, you will not discharge those cells. They can hold the charge. Now, all this is allowing the joint to be well serviced. and to work the way it is supposed to work. Well-hydrated muscles are strong, tight, tendons are strong. There's no way you will ever rip the tendon of the bone or break the tendon if the cells are well hydrated. Simply the electric tension, electromagnetic force, electric tension is there. Plus well-hydrated muscle is strong, tendon is strong. American Indians, when they were making, or not only Indians, in general, when people were making bows to shoot, well, what do you think they made the string out of? Most of it was made from a spinal cord, dehydrated nerves. Tissue, when you have it intact and then suddenly you dehydrate, completely take out of the water, the tissue stays there very strong. Leather, when you dehydrate leather, it compacts, becomes dense, and becomes very strong. Can hardly move it. But in a living organism, when it dehydrates, what happens? When you have a bowl full of air, like a cell full of water pressurized, ball is round. As soon as you start taking some air out, the shape of the ball is going to become oval because of the pressure on both sides. So expand outwards. We have to understand this. Same happens with our cells. As they dehydrate, they become oval. Wherever there is pressure, it caves in. Now, if you have spine, again, those are joints. And they are made in such a way that every vertebra is separated from another vertebra with a disc of cartilage. And then vertebrae are connected together with muscles through tendons. So same like any other joint of a body. So when you have a dehydration on a cellular level, toxic blood forces cells not to hydrate. All the cells of the body. So they all dehydrate. And what happens now with the joint? Well, muscle dehydrates, that is supposed to make tension, to hold it together. So now the contact becomes loose, unstable, easy to dislocate. Muscle becomes brittle, easy to break. Same is with tendon. They can overstretch and then they can break. Because cells are not fully hydrated, so they are kind of mushy. They move. And because the cell is lacking plasma, it cannot cleanse properly, so it is becoming overly acidic. Overly acidic cell cannot hold electric charge. So tension is gone. So now what happens? If you are talking about hip, the hip starts grinding. If you are talking about knee, again, it will start grinding because there is it's not anymore moving on this way. It can move any other way because there is no tension holding it together. At the same time, cartilage is getting dehydrated. So from its fixed position, it starts to sag. Now there is no water to be squeezed out. So when pressure is down, no water comes out. So the movement is being done dry, without lubrication. If it's fast movement, it starts overheating. Body tries to cool the thing down, it starts pushing lymph in that area. Or we say, or accumulation of fluids. We are robot. And robot is set with the program of maintenance. It's self-maintaining itself. But if we are poisoning this robot, well, robot does the best it can, according to the programming it has. Now, this time we are not going to focus much on the knees and hip. We are going to now talk about spinal cord. So, when the disc that separates vertebra is getting dehydrated, it starts getting mushy. So, when pressure is exerted, it kind of protrudes outwards a little bit. Huh? By doing so, it starts pushing a little bit of a nerve column, of spinal cord. Spinal cord that goes through vertebra, through spine, it is shielded with layer of fat. But usually, the layer of fat starts thinning up because of incorrect diet and dehydration. Now, when discs are now more flexible, as the spine puts pressure, they bulge out a little bit, they herniate. Doctors don't pay much attention to it if it's equal. But still, it starts exerting pressure on a spinal column, pushing it more to the opposite side where there is a spinous process, a lamina. Now, doctor says, well, you see, this lamina is a little serrated. Well, this should not matter because there should be fat protection over it. Bone is always serrated. But it is protected by fat layer. When that fat layer is thin or almost non-existent, well, this can cause irritation to the spine column, to the nerve system, and inflammation, especially if it is being pushed by protruding disc because it's too soft, flexible. So pushes it that way. So now, smart experts, again because they know nothing about healing, they know nothing about toxicity and hydration, so I call the mechanics. The solution is, well, take the lamina out. Okay, so give spinal cord some space to move this way. If it's being pushed from the cartilage inwards, well, on the other side you open the wall, give some space to the nerve. Well, you are weakening the spinal cord. You are taking a piece of spine out. And very often, this creates problems. Well, not very often, always it creates problems, but doctors don't care. So they actually have to make supports, and they have to bond the two vertebrae together so they don't move anymore. Well, this is only one of the problems that may irritate the nerve column in the spine. Another one is because of the same thing, dehydrated cartilage, disc, the spacing between vertebrae is decreasing. As is decreasing, this is bulging. Now also, they call it herniating. But doctors more refer to herniating when the spine is getting out of shape, because as the muscle tension is weakening, nothing is there to hold the spinal column straight. So when you move, usually, when you sit, this is how we should sit. But you decide to sit like this, because it's more comfortable. You relax. Well, the spine is going like this. So now the pressure is not straight. The pressure is crooked from a side, okay? So you squeeze one end of the disc more than the other, and the other one bulges out, shows irregularity. We call this herniated disc. Well, disc herniates evenly, then it's not herniated disc. If it herniates unevenly, then it's called herniated disc. Experts talking. When we are well hydrated on cellular level, then no matter what shape we make, the muscle keep pulling, and these anomalies do not occur. Plus, the cartilage is well hydrated, it's firmer, releases water when there is more pressure, slides easier, and very easily, when you come back, everything slides right back in its place. Okay, so no problems. But when you are dehydrated, and from this position now you slide back, well, there is no lubrication, so it just really doesn't go back. So you are just pushing, pushing, pushing. Plus, nothing sits correctly because there is too much movement everywhere. There is no muscle tension to keep it in a place. And now, simply gravitational field, electromagnetic field that pushes us down. The space between the vertebra is where nerves are coming out of vertebra to different organs, especially in lower back and upper back, neck area. Now, when the disc is dehydrated and squeezed, the openings where the nerves are coming out from the spine are diminishing. So they put pressure on nerves, cause irritation, inflammation, and we feel it as either pain or loss of sensation of touch, loss of painful movements, inability to move properly our arms, similar things with our legs. So doctors, mechanics, surgeons, again, they don't know how to heal. Nobody is focusing on healing. Nobody even think about healing. Symptomatically correct the problem. So how do you do it? Depending now where we see the problems, then doctor decides, okay, we'll cut a piece of spine out to give spinal column nerve system, a little bit more flexibility, a little bit more room, less pressure. And if movements are creating more pressure, well, let's fuse the discs together. So put plates and screws, pop. They call this curing. I call it butchery. I call it destruction of the human body. Because none of it is not necessary, but it's a good idea. Because doctors are creating irreparable damage. My brother was 11 years older than me. When he was in his late 50s, he had back surgery done because he had excruciating pain in the back. In his case, was lower back. Well, what do you think happens after this surgery? Inflammation set up, body is trying to repair things. He was in more pain. So then he needed another surgery to alleviate this pain. Yeah, cut some more, make a space for inflammation, so even when it inflames, it's not bothering you anymore. So the second surgery made it a little bit less painful from the first surgery, but still more painful than it was before surgery. So from then on, he has to be medicated. I would say good 80% of people with back surgery will have exactly the same experience, if not all. Attacking, damaging, perfect robot, it is always a bad idea. Because again, this is not piece of wood that you see some splinter, so you grind it out and now it's fixed. Whenever you touch something, the body tries to heal. Part of the process will be inflammation. Inflammation increases the volume in a space. So if you shave something to make it now work, well, after it inflames, it becomes more problematic than before. So you have to go back and shave much more. You are weakening the column. And body always tries to fix itself. There will be always reoccurring problems. It is laminectomy, destroying part of vertebra just to give space for nerves, is a nonsensical thing to do. Fusing vertebra is another idiotism. When all we have to do is hydrate. That's all we have to do. But hydrating on cellular level. Now, what happens with people that have already these surgical procedures? Well, if there was no fusion of vertebra, you can hydrate cells. The most important thing is that the disc of cartilage is going to hydrate. So it is going to beef up a little bit. So it will open the space between vertebra, release the pressure from the nerves. Now, if laminectomy was done, okay, there's not going to be too much problem, except it is now weaker spine. But well-hydrated muscles will regain the tension, a little bit of exercise to strengthen them a little bit up, proper lubrication, everything will work fine. Not as fine as it should, because mechanics did a damage. I always say, what doctor fucks up, body has a very hard time to fix. And sometimes it just doesn't do it. I'm not saying that there is no need for surgery. In accidents, want to put bone back together properly, and we don't know how to heal, because bones can heal rapidly. You can just put them in place, hold them there for half an hour, it is going to fuse. Stabilize it, and within a couple hours it should heal. Old shamans, aboriginal healers, they know how to do this. Now we don't, because we are being misguided through science. Science that is given to us through Kabbalah, that wants to enslave us, or has enslaved us. And we are all slaves. We all work for money that they control. So we are all slaves. We are breaking now the lies of science, exposing the truth. If you have a back pain problems, if you have scoliosis, if your body goes out of alignment often and you are going to go to chiropractor to adjust you, well, chiropractors these days are doing a fabulous job. They are starting to understand the body. They start to understand that you don't need to put weights and stretches and like medieval torturing stuff. Just properly stimulating the muscle, relaxing it and popping things in a place. It could be done without pain. But it cannot be maintained in that place if the cells are dehydrated. Chiropractor can adjust you perfectly. You feel great. And you are going out of his office and there is a step and you step a little wrong and you go like, oh, and puff, and you're out of alignment again. Needs another alignment. So, recommendation, hydrate on a cellular level. And after hydrating on cellular level for, let's say, 3-4 months, then go to chiropractor. After chiropractor aligns you, there's a great chance that you are not going to need another alignment. Now, this is a bad news for chiropractors, because if everybody hydrates, so how many clients one chiropractor has? 100, 200, 1,000? So after 1,000 days, he's out of job. Well, this is why medicine was created. To keep us all stupid, to keep us all dehydrated and toxic. So we are perpetual patients. Nothing is fixed. If anything, all relief. Relief through poisoning, medication, or through destruction of surgery. Every surgical procedure is attack on a body. It cuts the electroconductive pathways of the body, causing scar tissues. And body never functions the same. I mentioned before that my wife, when she was 28, she had a orthoscopic surgery on her knee. Doctor recommended it has to be done on both knees because there are spurs happening, bone spurs. Gotta shave things to work better. Nobody talks about dehydrated body, dehydrated cartilage. No spurs. Well, it was so painful going through one of those orthoscopic surgeries on one knee. Then my wife decided, no, I'm not going to touch the other knee until this one gets better. Well, it never got better. Almost 8 years later, when we met, my wife started hydrating. A year later, knee that was not touched by surgeon was perfect. No more making crackling noises, no more pain. The one that surgeons fixed, even today, 19 years later, it's not painful, but it's creating noise. Oh, tuck, 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 tuck. What doctor fucks up, God cannot fix. So, fortunately, God can do it. Why? Because it's creator. Because it can recreate it. It cannot fix it. It can recreate it. And fortunately, now we can recreate things with machines until we learn how to recreate them using our machine, our computer that knows everything. Why? Because human body is actually the embodiment of the conscious creative energy. If we would understand what this means, we would be manifesting instantly everything. You see someone losing arm in an accident, you just pow, look at it and you remanifest it for him. We'll learn how to do this. But before, we can do it now. But we can do only what ego understands. Ego, consciousness of physicality. Even when you give information like this, ego says, yeah, well, interesting, yeah. So try to fly. You jump through the window, ego says, well, are you crazy? You're going to fall down. Because consciousness of physicality means it is conscious and understands what is happening around him and understands things the way it experiences them. To understand something in a different way and having real faith in that it's absolutely this way, it's very difficult. And this is what is necessary for instant manifestation of physicality, because you have to create it in quantum field and then project it as reality. How do you create it in quantum field? Thought. Your thought is representation of vibration. So if you are thinking about manifesting arm, well, you have to first create it in your consciousness, in your mind. As soon as you think of arm, you see this arm, particular arm, that went off, you want to put it on, or you see how someone without arm, you look at it, oh, this particular individual and his arm. You start thinking, you start creating exactly what is being done in a quantum field. You are creating sacred geometry of putting this together. This is the frequency that your brain is creating. The only thing now between this and actual manifestation is faith. How much faith do you have that this is going to happen? How much faith you have in creating? Obviously we don't, because it is not so easy to convince the ego. To make it easier, we are going to be using now frequency emitting instruments. So we will understand, well, this machine can recreate this. And it does it by sending particular frequencies. And it's programmed to send these frequencies. So now once when you start seeing things happening, medbeds will be one of those things. When you actually start experiencing things happening, that, okay, it's frequency, then your ego can start clicking in, well, but I can make this frequency. Of course you can, because you even make the frequency of the machine. You make the machine. So, brain is calculator. It cannot invent anything. But whatever you put in it, whatever it becomes conscious of, it can recreate, it can replicate. So, whatever you can think of, you can replicate, you can create. The only limit of creation is lack of idea. We are going there rapidly. We are stepping in quantum field now. Q, quantum field. Everything will be quantum. Because we have to learn how to use this fabulous gift of creation. So if you have a back pain, going back to the original, if you have a back pain, you are dehydrated. On a cellular level, you have to hydrate. Well, it's not only back pain. If you have numbness, if you have a whatever issue concerning nerves, concerning spine, even simple scoliosis, you need to hydrate, but on cellular level. Drinking plasma is not enough. By drinking plasma, you are going to help provide plasma for body to cleanse blood and tissues. And you can eat any crap you want, and you will be successfully cleansing the blood and tissue. But you will not be hydrating and cleansing the cells, because if there is anything toxic, cells will refuse to engage osmotic hydration pumps. And there are so many things that we eat which are toxic to our cells. Starting first, plants. They defend themselves using toxic stuff. Proteins, enzymes. So, you cannot hydrate on cellular level if you do that. Carbohydrate you can use. It's whenever you cook stuff, a lot of these toxic enzymes dissipate, are converted with heat, and they lose toxicity. But at the same time, they release starch, which causes reprogramming on genetic level, which doesn't serve you also. But you can hydrate eating starches, no problem. But I highly recommend cut starches out and cut plants, green plants, all this stuff out when you want to hydrate on cellular level. And hydration will happen much faster. Bones, joints, nerves are mostly supplied with lymphatic flow, not with blood. And lymphatic flow is much slower, so healing, hydration, is much slower process when we are talking about spine, when we are talking about joints, when we're talking about brain, eyes. But it happens. Eventually, it all healed, pain goes away, cartilage rebuilt, so elderly people actually grow another inch or two because the spacing increases between vertebrae as cartilage disc hydrates. This is healing process. Unfortunately, not allopathic doctors or alternative medicine doctors know this because they all are stuck with science. As long as you think that science you are being told in a school is correct, you are lost and you cannot help anybody. You have to get away from science and go to science, observe, think, and you'll get it. I did. I'm a regular schmuck. I hated school all my life. I only finished quickly because I wanted to get out of there. And finally, I ended up doing what I love to do, sail. But purpose of my existence here is to educate. And to educate, I have to learn. And I have to learn the truth. No books will ever tell you the truth, because books are put together and spread around to mislead you. And we are talking scientific books, we are talking religious books, we are talking any kind of a book. And it's to mislead you. You want to know the truth? Ask. But don't ask someone that is taking his knowledge from books. Ask shaman. They know intuitively. Why? Because they are tapped right there into the source. Where did I get my information? Directly from the source. And information is so crazy, if compared to science, that I have to make many experiments on myself, my family, my wife, her family, and then later on, other people that I was helping, and I'm still helping. Truth is opposite to everything we are being told by our teachers, our scientists, our books, religious books. Everything is based on science, but then scientifically twisted. So we misunderstand it. I think I explained problems with the spine. If not correctly, if you still don't understand something, let me know. Maybe I'll try to take another shot at it. Stuff are too obvious to me. It's all how you focus yourself, how you allow your synaptic connections in the brain to adjust. And you start getting to understand the area of your interest better and better and better. It's with everything like this. Well, don't have your surgeries done. Heal. You can heal heart murmur. You can heal heart valve. You don't have to have it replaced. How? Hydration. I explained that. It's in my articles, it's in my videos. You can heal everything. Because you are self-maintaining, self-healing robot. Stop poisoning yourself, start eating correctly, and start hydrating correctly. And your body will do the rest. Thank you. Love you all. Till next time. God bless you. Namaste.